The European Association of Hospital Pharmacists is developing statements of hospital pharmacy that will provide the agreed benchmark to which all health systems in Europe should strive to achieve. EAHP's annual congress is a unique gathering of the profession and its interested stakeholders. So it was a perfect opportunity to bring people together to discuss the work on the statements so far in advance of the European Summit on Hospital Pharmacy in May 2014. We speak to the EAHP President, Dr. Roberto Frontini, to find out more.
Well, the FIP statement, our statement are based on, are now 6 years old. And that's necessary to have an update because pharmaceutical practice is changing. So we need an update. And secondly, the FIP statements are global statements. We need more a European flavor of such statements. But what we are doing is to merge some of them, to refresh them, and to add some of them just to get a European vision. That is the first. And how to use? Well, we will have a big project on best practice. We will have big project on implementation survey. And what we need is a vision for a European hospital pharmacist, how to make the best for the patients. Nowadays is very important to have a collaborative process and to have something where not only hospital pharmacists but also other healthcare professionals and more our patients, our targeting group, are giving their feedback to what we think as hospital pharmacists to be the best practice. That's why we started with a Delphi process. The Delphi process is a communication and review, structured and externally facilitated. This is why we should avoid any bias by hospital pharmacists alone. So we started in January with 2 rounds of Delphi process, reviewing the statements and looking on the level of agreement in a structured way. We decided to do this to get really objective outcomes. And at the end, we will have a vote on the summit in May. And that's very important. In the vote, we will have half of the vote by our members, which is hospital pharmacists, and a quarter by patient groups, and a quarter by health professionals, nurses and doctors, physicians. And we will weight the votes in the way that you get that balance, which means half, quarter, quarter. What does it mean? That hospital pharmacists will never be able, because we need an agreement of at least 75%, we will never be able to have an opinion without support by other groups. And the opposite is as well. So I think at the end we will have very strong statements for Europe and for the world. Hospital pharmacists will have a big impact of their practice because at the end, the scope of the statement is to give to hospital pharmacists a perspective from the needs of our patients. And this way of thinking will change the practice because we have to take now the perspective of the patients. It will be a step-by-step movement. We are not expected to change the world in one day. But if you have the right vision, the right goal, you will make the small steps. And I think that other initiatives by EAHP will help hospital pharmacists to move in the right direction.
Okay, for reviewing the statements and to build the European statements on hospital pharmacists, we decided, the group and the board of EAHP decided to use as a basis the FIP Basel statements, the 75 Basel statements. And the group to whom I want to everyone, to every member of the group, I want to thank, because they did a wonderful job. We looked through all the 75 Basel statements, and we tried to choose those who were most important for hospital pharmacy activity and those who means a lot for patient outcomes. So we select the statements, the most important statements. We delete others that we thought that would not be good for European hospital pharmacy, because the Basel statements are for all the world. So we cut some, we merge others, we put in another position, we add some new because we found that there were some gaps on the Basel statements, and we did our work based on these premises. Why we do it, to whom we do it, how we do it, and what we do. That was our questions to answer to the aims of hospital pharmacists in Europe.
So the essential features of the Delphi process are that we're working with a group of experts, people who know about the topic already. And the idea is that they'll have a discussion, a conversation, either face-to-face or, in this particular case, electronically in a discussion group. There are several rounds of discussion. The idea being that the experts are anonymous to each other. Nobody knows who is talking electronically, and equally those discussions are facilitated. So if somebody says that they agree or they disagree, they'll be asked why they agree, or in particular why they disagree. So as a result of this structured process, the idea is that even the experts will refine their original answers, and gradually there'll be a coalescence of agreement, so that we reach a consensus in the end after 2 or 3. In this case we've had 2 rounds, sometimes it's 3 rounds, but it's a predetermined number of rounds, and then we stop. And you measure success by scoring the answers and applying an average score. There are some caveats about whether you should or shouldn't do that, but on balance, pragmatically, you need to see whether things have changed through the rounds. So we've used the average score in this case. Well, I think there have been a number of main issues that we've debated. I think first of all the thing to say is that we had a predetermined 2 rounds, and we've completed those 2 rounds, and we have got much better consensus now than we had at the start. So on the basis of how we can measure this, things have reached, you know, the process has worked, and we're much closer to a consensus now than we were. I think there have been a number of interesting things. So first of all, it's clearly tricky to do this across the different countries across Europe. People have different perspectives. I think that debate's been quite interesting. Some people have more issues with you know, capacity and resources within their country, and understandably find it difficult to you know, to look ahead beyond their current position and where they are. I think the other thing to say, the big strength of this, is that we've had patient groups and other healthcare partner organisations involved in this process. It's not just been hospital pharmacists talking to each other, and I think that's been the other interesting thing that we found, that bringing those other groups in has stimulated the debate as well. Well, I hope at the summit we'll start with a series of statements that are reasonably robust. Having been through this Delphi process, I think they have in effect a strong evidence base behind them. So we go in from a position of strength, already having achieved a degree of consensus. There's a small number of statements that we perhaps need to discuss and debate further, and that, I think, it's now right to do that face to face rather than electronically and anonymously. I think it's we're already seeing that the environment of the anonymous online process has in a number of instances with the statements reached the point at which doing that again won't help anymore. We need to sit down face to face now, and I think the other thing we'll see at the summit is again more interaction from patient groups and from partner health organisations. Understandably, people from those two constituencies know less about hospital pharmacy than the hospital pharmacists do, and face to face it will be possible to encourage their participation, their question asking, and for us to get their views. It will be easier to do that face to face, I think, than online. Easier for them to contribute actively.